Hey, future medics, and welcome to Anatomy. We're going to get started building the foundations of A&P. So, before we start learning body cavities and where organs are located, you need to understand the main breakdown of the skeletal system because it's how we divide a lot of things in anatomy. There is the axial skeleton and the appendicular skeleton, and we're going to start here because we need to know the difference. I know anatomy is a lot, but we're going to make it simple. The axial skeleton is anything to do with the central nervous system, the skull, the vertebrae, the thoracic cage, because it articulates with that spine down the back of our patient. So the axial skeleton is all about protection. It protects the brain, it protects the spinal cord. The thoracic cage protects the heart and the lungs, which are all vital organs for survival. So, this is a really important part of the body to know how to assess for trauma assessment. Now, the appendicular skeleton deals with the arms and the legs and the bones that connect those appendages to the body. Appendages, thus appendicular, you got it. Okay, so the pelvis connects the legs and the shoulder girdle connects the arms to the axial skeleton. So we deal with those as well in the appendicular. Whenever you're thinking of um, long bone fractures or joint injuries or traction splints, we're usually dealing in the appendicular world. Here's why this is important. When you're dispatched to a call for a patient who fell from a ladder, and they have midline spinous tenderness. So it is on the back, it is tender along their spine. We're already thinking we need to be taking spinal precautions and we need to be doing neuro checks on this patient because they have an axial skeletal injury, which involves the central nervous system. So the fact that they have an injury that is involving the axial skeleton means we need to be very careful and make sure there's no damage to their central nervous system. And that's when we start doing those neuro checks and we start doing spinal precautions. But if we get called to a motorcycle accident with a femur fracture, if they're not having back pain or neck pain and we're just dealing with this one isolated femur fracture, that's appendicular. So we're not worried about the CNS because it hasn't been involved. We're worried about bleeding. We're worried about them being able to move their toes, which are distal to their femur, right? So knowing the difference between what is the axial skeleton and what is the appendicular skeleton helps us kind of predict complications that are going to come from the injuries that we see. Now that you know how the body is divided into axial and appendicular, we're going to go one step deeper inside of the body, and we're going to see how everything is divided and organized so we can learn how it works so we know what to do and what's maybe happening when it's not working right. Just like a people mechanic. I'm going to keep telling you that because I think it's the best definition. You're doing a really good job. You're building a really strong foundation, not just for school, but also for the field. And that's how you start thinking critically and clinically. I know this can be overwhelming, but I believe in you, even if you don't believe in yourself right now. I'll see you soon.